Hi everyone, I'm Mrs. Princey, Associate Professor in Mental Health Nursing. As you know, schizophrenia is a psychotic condition characterized by disturbance in thinking, emotions, as well as behavior. And if you take the age group which is mostly affected, you can see it falls between the age group of 15 to 30 years old. So it doesn't mean that schizophrenia doesn't occur in the elderly population. Yes, so schizophrenia can affect anybody. Yes, any individual with any age, any gender can develop schizophrenia depending on the situation or stressors that they will face in their life. Right. So today the topic which I'm going to discuss is schizophrenia, we can say, in the later period of the life. Individuals aged 55 years and above account for about 25% of population who are going to be affected with schizophrenia. Among people aged 60 years and above with mental and substance use disorder, schizophrenia ranks third in causes of disability adjusted life years. So that is the incidence, or you can say the prevalence. And it is estimated that the prevalence of schizophrenia in older adults set to double and reach about 10 million worldwide by the year 2050. So you can imagine the prevalence or epidemiology of schizophrenia that occurs in the older age group. It's considerably high. Moving on to the mortality and morbidity of schizophrenia in the older age group. Older patients with schizophrenia include individuals with the early onset of schizophrenia that persists into later life. And also we have got the older age group wherein the onset of schizophrenia actually occurs in the later period of time. So we have got two groups of schizophrenic patients. One is the actual schizophrenic patients who developed it during the earlier stages are will be persisting in the later period of their life, and also we have the group of people who develop schizophrenia during the later age group or during the older age. So we have got currently two generations of schizophrenics, that is the old wherein the age group is 75 years and older. Then we have the young old generation of schizophrenic. The age group is 55 to 74 years of age. So these are the two generations of schizophrenics that we have. If you take the mortality, the risk of mortality is 2 to 3 times higher in the schizophrenic patients compared to the general population. In older adults with schizophrenia, the mortality rate and death is caused by suicide and accidents, which are higher in the healthier peers. So that is about the mortality rate of schizophrenia in the older age group. Coming to the morbidity. So along with the schizophrenia, the patients develop the medical disorders. So we have got concurrent disorders, schizophrenia with the medical disorders which contribute to the morbidity rate. So it is found to be that older persons who are affected with schizophrenia also have the higher rates of congestive heart failure, chronic obstructive pulmonary disease, and hypothyroidism than unaffected peers. Now, why this happens in the older schizophrenics? It is because of mainly the lifestyle of such kind of patients, very poor diet, habits such as smoking, physical inactivity, as well as the effects of the antipsychotic drugs. So that is about the morbidity. So you can imagine along with schizophrenia, we have got the other medical conditions to be concurrently present in the clients, especially in the older age group. Moving on to the symptoms of schizophrenia in the older age group. So, especially we can notice as the person gets aged, the positive symptoms of schizophrenia reduces or decreases, whereas you can make out that the older clients usually have the negative symptoms of schizophrenia. So, what are those symptoms of schizophrenia? First one is the cognition. So, you can notice that there is a significant cognitive deficit in areas of executive functioning, speed of processing, attention or vigilance, working memory, verbal learning, visual learning, reasoning, as well as the problem solving areas. So, this is the symptoms that you can notice in the cognitive area of the functioning. Next is the symptom of dementia that you can notice along with this schizophrenia. The clients may also have the dementia, that is the Alzheimer type of the dementia that you can notice along with the psychotic features. Moving on to the next symptom, it's the insight. So, what is insight? It's an ability of an individual to be aware of himself, to be aware about his own, medical condition that he is undergoing. If you take the older clients with schizophrenia, they have an impaired insight. That is, more than 50% of schizophrenic patients have moderate to severe deficits in the area of insight. Impaired insight has got a significant effect on the health of an individual by reducing the patient's awareness of their mental disorder, its symptoms, implication, as well as the treatment. So these are the symptoms that you can notice along with the negative symptoms. These are the other symptoms that you can notice in the older clients with schizophrenia. Moving on to the treatment, so we have got the option here that is the psychopharmacology. The older adults are more susceptible to the adverse effect of antipsychotic drugs that we use for treating schizophrenia compared to the younger generation or younger schizophrenic clients. Now, why this happens? It is mainly because of age-related pharmacokinetics that increases the distributed volume and the half-life elimination of the antipsychotic drugs. Also, it is noted that there will be changes in the permeability of blood-brain barrier that increases the drug availability. So, as the client ages, right, the antipsychotic medications that we administer will not be so much effective because of this barrier which happens for the drug to pass the brain. There are also the psychodynamic changes wherein you can notice decrease in the absolute number of dopaminergic neurons and D2 receptor density in the brain. So you can imagine the neurons itself, the density of neurons itself is decreased in the older schizophrenic patients, which will contribute again to the increased adverse effect when the patient takes up the antipsychotic drugs. What are the adverse effects that you can notice in the older schizophrenic patients? So we have got the adverse effects of antipsychotics like the Parkinsonian conditions, tardive dyskinesia, falls, as well as the metabolic syndrome. These drugs can also cause the effects like impairment in the cognitive and functioning capacity of an individual with schizophrenia. So, what are the drugs that can be used in schizophrenia? In spite of the adverse effect and the effect of the drug, which cannot be, that extent. However, we use certain antipsychotic drugs for the elderly or the older age group. So, the drugs which are very effective are the olanzapine as well as risperidone in the non-resistant schizophrenic patients. Second generation antipsychotics with the low anticholinergic burdens can also be used for treating these conditions. For example, we have aripiprazole and the drug ziprasidone. So these are few antipsychotic medications that we can use in the older schizophrenic clients. Moving on to the non-pharmacological psychosocial interventions. So, apart from the psychopharmacological agents, we use the psychosocial therapy in these clients. These non pharmacological interventions are really going to help the client by reducing the psychotic symptoms and augmenting the pharmacotherapy. So, number one psychosocial therapy we have is the cognitive behavioral therapy, which is widely used to resolve the problems of social relatedness, positive and negative symptoms, as well as mood in the older adults with the schizophrenia. The next therapy is the social skill therapy, which is used to treat the difficulties in social interaction, while exercise programs helps to reduce decline in cognition and activities of daily living. So these are the two psychosocial therapies that we can use for the older clients. So the knowledge of schizophrenia in the older adults is very much limited. We have got the clients who have developed schizophrenia during the earlier period. So as they age, even the disease of or the disorder of schizophrenia grows, right, which can result in the schizophrenia in the older adult. So the knowledge of schizophrenia in older adults are very much limited, related to the use of pharmacology or the therapies which can really help out these clients. More research is required on this area so that we can help out these clients with the novel age appropriate services and treatment to improve their impairment. Right? So, very important that geriatric group are also to be considered and they have to be helped out. Right? So, hope you all have understood the topic.